And now it's time for a message from our sponsor, the Biosimilars Forum.
The cost of healthcare continues to rise. Congress said they want to find ways to reduce healthcare costs and break down barriers to affordable options. Biosimilars are the next generation of generics, and improved access to them could save up to $250 billion in healthcare costs. Increased access to biosimilars as a lower-cost therapy would not only save money, it could save lives. Tell Congress to improve access to biosimilars. The time to act is now.
Good afternoon, everyone. I'm Julie Reed, the president of the Biosimilars Forum. As we just saw, biosimilars offer lower-cost treatment options for patients struggling with chronic diseases and illnesses like cancer, rheumatoid arthritis, and Crohn's. While many of you may not have heard of a biosimilar before today, they are common-sense treatment options that can help to lower costs for patients and seniors now, playing a critical role in reducing drug costs. As the U.S. battles the COVID-19 pandemic and Congress has authorized more than $3 trillion in critical funding to fight off the virus and help our economy, our healthcare system also needs to look forward to lowering drug costs. Estimates show that biosimilars could save the U.S. healthcare system as much as $250 billion over the next 10 years. So as we begin to rebuild the economy in a way that reduces the financial burden on patients, on employers, and the healthcare system at large, biosimilars will play a key part of that solution. So how can we capture these billions of dollars in savings? We need Congress and the administration to enact simple, common sense policy changes. One, increase patients' access to lower cost biosimilars, and two, encourage their use. Congress has already taken notice of the cost savings potential for biosimilars. In the last year, bipartisan groups in both chambers have introduced 8 pieces of legislation to encourage the use and access to biosimilars. These will all save patients and the federal healthcare system billions of dollars. Just last week, Senators John Cornyn and Michael Bennet introduced a bill to implement a shared savings program in Medicare Part B. This policy alone is projected to save up to $3 billion for taxpayers over the next 10 years. Additional legislation has been introduced that waives vulnerable patients' out-of-pocket costs, and another would lower the cost and encourage and improve reimbursements for providers to use lower cost biosimilars. It's clear biosimilars are a key part of Congress's efforts to rein in healthcare costs. So how can we start providing financial relief to patients, employers, and the healthcare system we all pay for? Today, I welcome Alex Brill and Annette Guarasco to discuss how and why Congress and the administration must move quickly on the bipartisan solutions to make good on their promise to lower healthcare costs for Americans. Thank you all for joining us, and I'm going to start with a question for both of you, Alex and Annette. So my first question. The American people, specifically patients, employers, and taxpayers, have long called for financial relief in the healthcare system and reduced spending. Given the unprecedented moment we're in, how do you think Congress or the administration can make good on their promise to lower cost? And Annette, why don't we start with you?
Thanks, Julie. We need a robust, competitive marketplace to lower drug costs, particularly with biosimilars. The large employer members of our trade group, ERISA, provide health coverage to nationwide workforces, and they're struggling to keep up with the rising cost of healthcare. We don't need government controls or price setting. We need more competition. That means more biosimilars on the market so they can compete with brand biologics and with other biosimilars as well. This starts first with the FDA approving more biosimilars in a streamlined process, and also with Congress enacting legislation that'll stop the legal system gaming that happens and prevents biosimilars from coming to the marketplace, forcing patients and employers to spend more in the interim.
Thanks. I think Annette's exactly right that competition is a key part of driving that cost savings opportunity. Julie, you said in your remarks a moment ago that it's in an unprecedented moment, and it certainly is as the fiscal situation has deteriorated significantly at the federal level, both as a result of the legislation to respond to the public health crisis and the economic recession, as well as natural factors that are driving down revenues and driving up spending. The federal government needs to find more efficient ways to spend its dollars, and a big part of that has to do with its spending on pharmaceuticals and in particular biologic drugs. Biosimilars, I think, is a great answer to that problem.
Thank you, Alex. Annette, a question for you. More than 150 million Americans have health insurance through their employers. Eric's recent study showed how much employers could have saved by replacing just 2 originator biologics with a biosimilar. Can you tell us about this and how increased access to biosimilars can help employers try to balance the cost of providing employees insurance options?
Happy to. Employees love their employer-provided health insurance. But the spiraling costs of so-called specialty medications, which include biologics, are creating enormous pressures on company budgets. Just 1% of prescriptions are for specialty medications, but they account for 40% of the costs. With employers paying 80% of the cost of health coverage for their workforce, they care a lot about opportunities to save money while keeping their employees and families healthy. So we studied the spending of 13 very large companies across every industry sector. The Johns Hopkins researchers focused on 2 biosimilar medications that had been on the market for a while. And what they found is that the companies on average spent $5 million just on those 2 medications alone, but importantly, would have saved $1.5 million on just one biosimilar if it had been used in place of the biologic for an entire year. And that patients would save money too. For just one of the biosimilars, patients would be spending 45% less on the biosimilar than on the brand biologic alternative. So with more biosimilars available and accessible, the savings means lower costs for patients in terms of premiums and lower cost insurance, and more money for the employers to spend either to enhance the benefit to their workforce or to rehire. Employers drive healthcare costs and quality improvements all across the country in communities where everyone lives and works. And biosimilars play a key role in helping ensure that their health dollars can go further.
Thanks, Annette. That is so important as we all look at the economy and the impacts on the economy of COVID. This is so important to have these lower cost solutions. So thank you so much. Let me ask Alex, as an economist, and especially one you're so specialized and smart on the Medicare policy. Originator biologics are one of the largest spend for Medicare and for our government. Why do you think that is, and what are some near-term steps that could be taken to help lower those costs?
Sure. It's absolutely the case that as we look at the increase in pharmaceutical spending, that's being driven by an increase in spending on biologics, not on small molecule pharmaceuticals, the older, simpler products. That's in part because there are lots of new biologics coming to market, and many of those products are the most innovative treatments we have for the diseases that we face. And these are welcome products, I think, from a healthcare treatment perspective. It's also the case that the price of many of these products are rising over time. And finally, we live in an aging population. As more and more Americans turn to Medicare, and the Medicare becomes a larger part of our overall healthcare system, we have more seniors in our economy, in our society. We're going to be spending more on these products. In terms of what we can do to respond to that, I think what the critical principle that we should be looking for is trying to align incentives, trying to align the incentives between the physicians who are making the who are doing the prescribing, and the patients and payers who are either paying a copay or deductible, or ultimately insuring the cost of healthcare. There's a variety of ways to better align those incentives. One of those ways is something I wrote about recently in a report with the Biosimilars Forum. It would be for CMS, in particular the Innovation Center, to launch a demonstration project, a shared savings program in Medicare Part B for biosimilars. This would reward physicians for increasing their utilization of biosimilars, which would both create that incentive for physicians and align that incentive with the desire of payers, taxpayers, to lower overall costs in the biologic spend category.
Thanks, Alex. So one final question for both of you. Here we have a solution to help lower costs for medicines and lower costs for our government, employers, and taxpayers. What do each of you think is the biggest barrier for unlocking this cost-saving solution called biosimilars? Alex, you want to take it first?
Sure. I think there are honestly, you asked for one, but there are actually a couple. One is there's just a lack of information. There's a lack of education and awareness. And I think that policymakers, the FDA, I think payers are working on tackling that information problem. And then the other is the issue I mentioned a moment ago, aligning incentives. And so we need to both educate people about the opportunity that biosimilars offer the healthcare system, but then we need to encourage them to utilize and prescribe biosimilars. By aligning the incentives between the prescriber and the payer, that's the best way, the most powerful way, I think, to unlock the savings opportunities.
Thanks, Alex. Annette?
And I couldn't agree more. I think there are misunderstandings about what biosimilars are. And there's a particularly unfortunate one in that people think that the FDA needs to do something to designate a biosimilar somehow as interchangeable before it could be prescribed to a patient. And that's simply not the case. So I think we need more education. FDA is doing a great job. And look, from large employers where I sit, they do try to design their plans to align the incentives correctly, but the other systems at place create cross purposes so that the most affordable drug isn't necessarily prescribed to the patient each and every time, and we need to do better as a country for that. And Congress and the FDA have important, and CMS have important roles to play in all of this. There are answers, and Congress and the administration just need to act.
Thank you. Thank you so much. Thank you both. I know you're both very busy, and we really appreciate taking out the time. This was a great discussion. It's clear that Americans need lower healthcare costs and more savings, and biosimilars can help that. Right now, as we discussed, there's bipartisan solutions in front of Congress and the administration that could increase access to lower cost biosimilars and unlock billions of dollars in savings. So they need to act, and they need to keep their promise to help lower healthcare costs for all Americans. There really is, especially today, there's no time to waste. I want to thank both of you for joining us today and having this very important conversation. And now I'm going to hand it back to you, Steve.
Thanks so much.